Good evening, Hattiesburg. Thanks for joining us for this COVID-19 briefing for Monday, November 23rd. A lot of important information to share with you today. We'll start with today's numbers. These are system-wide testing numbers. We'll actually start with hospitalizations. 78 people are in the hospital today between Merit Health Wesley and Forrest General. They are COVID positive at 78. That's well over where we've been for the last 2 weeks. Of those 78, 16 are in the ICU right now. The one thing that's kind of the saving grace for us right now, even though we're approaching the 80 mark, is our ICU numbers have kind of held low. Now, typically what we've seen throughout this pandemic is that when hospitalization numbers go up, the ICU numbers will follow after a week or two. And then, of course, we start to see deaths follow that. And so we're hoping that we can reverse that and see those numbers come down. Statewide today, there were 699 new cases reported, no new deaths, fortunately. Over the course of the weekend, Forrest County saw 43 new positive cases on Saturday, 15 on Sunday, and then 65 today. LAMAR County saw 33 on Saturday, 16 on Sunday, and 80 new cases today. The metro area, 3-day total, of course, is 252 for that 3-day area. Since this began, Forrest County is at 3671, LAMAR County is at 2818. Our 5-day average, we've hit some new ground today, unfortunately, over 70 new cases. The previous high was back on July 30th. We got to 63.8. That number's now above 70. Inside 14 days, this is the number of people who have received their positive test result within the last 2 weeks. Forrest County, that number is at 384 now. LAMAR County is at 308. Again, that's the number of potentially active cases. So now we're knocking on the door of 700, a place we haven't been in since the first part of August. Week over week, seen quite an increase since last Monday. Forrest County was at 272 active cases. Again, that's an estimate, but a rather good estimate. 384 today. LAMAR County was at 213, 308, so an increase of 485 to 692 just in the last week. Hospitalizations, the bigger concern is this because the pressure it puts on our healthcare system. So 62 up to 78, ICU admissions held steady at 16. Our overall goals are the same since this began. We want to protect the vulnerable, which are the people over 60, people with underlying or chronic health conditions, prevent overrun of the healthcare system is our second goal, and then, of course, try and keep things open while we prioritize public health. We do that through 4 things. The widespread availability of testing. Of course, we have the Cough and Fever Clinic. Merit Health Wesley has its outpatient clinics that will be open this week. CE will be open Wednesday and Friday from 8 to 12, and, of course, the health department is now doing drive-through testing, including rapid testing. They'll be in Purvis tomorrow at their health department on Tuesday, and they'll be back at the Forrest County branch at 42, Bypass, and 49 on Wednesday and Friday. Watching our own data and listening to all voices. The data, there are several things this week that are very concerning to us. First thing is 78 hospitalizations. Now, as we approach this, as we started to see numbers rise at the beginning of November, we kind of put 70 as the red line that we were going to do something and act. The 78 hospitalizations in the winter months mean there are going to be fewer beds available for other things. And as of this morning, when we started the day, there were 6 beds available at one hospital. Of course, there are a lot of discharges, but then we fill back up in the evenings. But 78 hospitalizations is a big number for us. The estimate of active cases has increased by nearly 300 in our metro area over the past 2 weeks. Those are not total cases. That means there are an extra 300 sick people who are out now in our community right now. Forrest and LAMAR counties, out of the 699 cases we told you about today, Forrest and LAMAR counties accounting for 20% of those. That's concerning. And of course, as we mentioned earlier, the 5-day average is at the highest point since March. And typically on Mondays, we have lower test amounts because of what the labs that are open on Sundays. But having that many cases on a Monday does not bode well for us going into this week. So to make the situation more alarming, according to our emergency management personnel, these new cases that we're talking about in the last couple of days are not coming from Southern Miss, William Carey, or any long-term care facility which we've seen when there have been previous spikes. And our goals have been the same since this began. Protect the vulnerable, prevent overrun of the health system, and try to keep businesses open while we prioritize public health. However, it is very clear that if we do not change course now, collectively and individually, we won't be able to accomplish any of those goals, at least in the foreseeable future. And toward that end, the City of Hattiesburg will act to facilitate an environment that enables people to make better decisions and keep our community safe. So beginning Wednesday, restaurants, bars, and indoor entertainment venues will once again begin closing for in-house service at 10 p.m. Delivery, drive-through, and to-go orders can still occur after 10, but we have done this before during the July and August spike when system-wide hospitalization rose to over 100 and ICU utilizations went to the high 30s. It's important to know that our health system cannot handle that level of impact this time if it occurs, particularly as we head into winter months, and that's why we're taking this action. Now, I'm not naive to think that COVID-19 is only transmitted after 10 p.m., but we do know that part of the key in slowing this down is to reduce the amount of unnecessary gatherings. And quite frankly, when alcohol is involved or we're just having fun with friends, sometimes we get a little more careless about mask wearing and social distancing. So we made the same move to 10 p.m. at the end of July, and within several weeks, thanks to your efforts and the efforts and awareness of a lot of people, hospitalization numbers came down. And that's our hope this time as well. This order will run until December 12th, and if we can see a reset in our local data, then we can evaluate on expanding those hours back out again. However, personal responsibility is more important than anything I or the government or the governor can do. This means when you make plans for Thanksgiving, please use common sense. When you decide to go shopping on Black Friday, consider the risks and act accordingly. Wear your mask correctly and consistently. Practice social distancing. Avoid large crowds. Help us protect the vulnerable, many of whom you know. Help our health system and our healthcare workers. Help us find the functional normal to still find ways to celebrate things like New Year's Eve and Live at 5, even if those things look a little different. This holiday season can be one where even in the midst of pandemic fatigue, we summon the best of ourselves for what is hopefully the home stretch as we wait for a vaccine. Or it can be one of a lot of bad news and potentially not having those whom we love around for the holidays next year. We can do this, but we need your help and we need it now.